Welcome to this podcast from the Medical Journal of Australia. My name is Sally Block, the MJA's news and online editor. Australia has its first new cancer screening program in 20 years, this time for lung cancer. Today we'll be discussing this new program in depth, as well as the role of primary care and the supports available in delivering the program. This podcast is sponsored by the Australian Government National Lung Cancer Screening Program. Professor Vivienne Milch is Medical Director at Cancer Australia. Professor Milch is also Medical Advisor to the Australian Commonwealth Department of Health, Disability and Ageing on cancer screening policy. She joins me now. So, Professor Milch, can you tell us what the National Lung Cancer Screening Program is and what does it aim to achieve?
Thank you so much, Sally. So the National Lung Cancer Screening Program is a national screening program. It's the first new screening program we've had in Australia for 20 years. So we have a screening program for breast cancer, cervical cancer and bowel cancer. And now we have a new fourth national screening program for lung cancer, which is very exciting. It is hoping to achieve earlier diagnosis of lung cancer. So at the moment, lung cancer is the biggest cancer killer in Australia, and it has such poor outcomes generally because it's diagnosed late. So by the time somebody comes to their doctor with symptoms that may suggest lung cancer, they're often at a late stage of diagnosis, stage 3 or 4. What we're trying to do with the National Lung Cancer Screening Program is to use a low-dose CT scan to find lung cancer before symptoms have started. And if we can actually identify lung cancer before symptoms have started, potentially at stage 1 or 2, we have a much greater range of treatment options and a much greater chance of cure from those treatment options and certainly reducing deaths from lung cancer.
So who is eligible for the program and why?
So unlike those other cancer screening programs, the National Lung Cancer Screening Program is a targeted program. That means that it actually is for people at highest risk of lung cancer. So the eligibility criteria are people aged 50 to 70, people who currently smoke tobacco cigarettes or have quit in the last 10 years, people who have a history of at least 30 pack years of smoking history. So these are people who've got quite an intensive history of tobacco smoking and also who have no symptoms or signs suggestive of lung cancer. And that the reason for that is if they're symptomatic for lung cancer, then they go down a different investigation pathway, down a diagnostic pathway, not a screening pathway. But what we've done in designing this program is to identify this group of people who are at highest risk of lung cancer. And we know that at that point, the benefits of lung cancer screening outweigh any harms or costs. And we're going to try to find this group of people and screen them in order to reduce deaths from lung cancer.
So what role does primary care play in delivering this program?
So GPs are very, very important for the program. They play a critical role. So in order for someone to have a low-dose CT scan, which is the screening intervention, they need to see a health provider, such as a GP, usually a GP, to get a request form for a low-dose CT scan. In some states and territories, nurse practitioners can also provide that low-dose CT scan form. So when a person comes to see a GP, and it might be that a person's seen an ad for lung cancer screening, it might be that they've been told to come and see their GP by another health provider, like a quitline counsellor, or another type of doctor might actually send a person in to see their GP, or maybe a family member might suggest it. Or maybe a GP might actually think when they're seeing their patients, I wonder if this person would be eligible, and they might go through all of their patient records and highlight people who might be eligible. So then the GP will discuss with the patient potential for taking part in the lung cancer screening program. And there's a lot of resources that we have on the National Lung Cancer Screening website about having that conversation with your patients. about participating in the program. Now, once a person has agreed to participate, the GP will give them a form to have a low-dose CT scan, and they'll enrol them in the program through the National Cancer Screening Register. So we're encouraging all general practices to be integrated with the National Cancer Screening Register. Now, a lot of practices are already integrated, and we encourage everybody to be integrated with the register for a number of reasons. Not only because it's easy to enrol your patients for lung cancer screening, but it's also important for being able to look at their screening history for cervical and bowel cancer screening, because, of course, the National Cancer Screening Register has one person, one record for all 3 screening programs if they're eligible. And so you can check up on your patient's cervical or bowel cancer screening history. You can also order a bowel cancer screening kit if that is appropriate, but certainly you can enroll someone in the National Lung Cancer Screening Program. And then the GP will give the person their request form to go off to have their low-dose CT scan, which they go off to have in a local radiology facility. Might be public, might be private, but not separate to the system like it is in BreastScreen, but just the usual local radiology provider. We're also providing CT scans for people in rural and remote areas through mobile screening trucks. The only other thing that I would say is very, very important, and this is a critical part of the program, is that GPs have a big role in providing smoking cessation supports where that's appropriate. If somebody is still smoking, that this is a real teachable moment to talk about smoking cessation.
So, how has this new program been designed to meet the needs of priority populations, such as, or particularly First Nations peoples?
So it's really important, we knew right from the beginning in designing this program that we need to co-design the program with Aboriginal and Torres Strait Islander people in mind. So Aboriginal and Torres Strait Islander people are twice as likely to be diagnosed with and die from lung cancer. It's a hugely problematic and disproportionate impact for Indigenous people in Australia. So we co-designed the program with Notre, that's the National Aboriginal Community Controlled Health Organisation, and all of the resources have been co-designed, and we're really proud of those resources, which are available through NACCHO and also on the department's National Lung Cancer Screening Program website. We have, as part of all of our education, made it really clear that it's the responsibility of all healthcare providers to work towards providing culturally safe and appropriate care. And certainly when it comes to lung cancer screening, cultural safety, the way we communicate it with our patients is tremendously important. And we want to make sure that all practices actually have undertaken formal cultural safety training to assist the people working there in fostering and providing culturally safe care for Aboriginal and Torres Strait Islander people. The other thing to say is that Aboriginal health workers and health practitioners are very important in the program. So even though they're not able to actually order the low-dose CT scan, there are very clear roles and responsibilities for Aboriginal and Torres Strait Islander health workers. And they include promoting the program to Aboriginal patients, helping to recruit participants for the program, helping to assess eligibility. That's a really important step. Facilitating shared decision-making and enrolling the person in the National Cancer Screening Register, certainly offering smoking cessation support, and providing and supporting the communication of results after the person's had their CT scan.
The NCSR is crucial for the delivery of this program. Can you talk us through how the NCSR is being used for referrals and results in communication?
Yeah, so thanks, Sally, for the question. I think that we should all be really proud to have a national cancer screening register that we do, that oversees and supports all 3 of those screening programs in bowel, cervical, and now lung cancer screening. There's certainly it's an amazing infrastructure that we have, and it collects all the information about those 3 screening programs. There's a lot of ways that health professionals interact with the NCSR. Firstly, that a GP or other health provider will enrol the person in the NCSR. After that's happened, the actual participant will get a welcome letter from the NCSR. And then if then the person goes along and has their CT scan, the radiologist then interacts with the NCSR, providing a systematic report to the NCSR on the basis of reading the low dose CT scan. And the NCSR then communicates to the GP and also to the patient participant to tell them either that their scan was fine and they need to just come back in 2 years' time, or that there was something that they should come back and talk to their GP about. Should there be a finding where the person has to have is advised to have another CT scan in 3, 6, or 12 months, or if there was something that required more immediate referral. So the NCSR communicates with participants, it communicates with GPs as like a safety net. It also holds all that data so that we can follow what's happening in the program and we can report in real time how many people are participating, how many scans are being done, and we can improve on the program over time. What will then happen is that the NCSR will send a reminder letter, again, if the person's had a normal CT scan, normal low-dose CT scan, that the NCSR will send a reminder letter in the right period, if it's 2 years, if it was a normal scan, and the NCSR would send a reminder letter to the participant.
So, stigma can often be a barrier for receiving care amongst patients who smoke. How can primary care providers manage this?
So we know from the work that we've done in designing the program and also in international trials and international programs that stigma is a really big barrier when it comes to lung cancer, smoking, and lung cancer screening. There's a lot of people who think it's too late after they might be diagnosed with lung cancer and don't want to know, or they don't deserve to screen because they smoke. But it's really important that health providers actually help patients navigate these feelings and participate in the program. So it's important to know that we're looking at people who are aged 50 to 70 who've got a significant history of smoking. Now, many of those people started smoking when they were very young, and they were impacted and influenced by the tobacco industry. And there are structural and historical determinants of health-related behaviours that actually are the responsibility of the tobacco industry. Smoking is an addiction. It's a very difficult thing to stop. And I think it's really important to take away that sense of blame and that sense of stigma that is related to both smoking and cancer risk when we're talking to our patients. So one of the things that we've done as part of the design of the program is we have developed resources about how to talk to your patients about smoking and about lung cancer and how to address that stigma. The other thing is that we've designed some online education, and we'll certainly provide links to that education as part of this podcast that actually takes someone through this addressing stigma in a step-by-step way. It's really, really important if we're going to maximise our participation in the program.
What resources and education are available to support doctors and other healthcare providers to deliver the program?
So we've developed a lot of education. We've developed just brief education for GPs as a sort of a brief overview. We've got more detailed information and education as part of CPD accredited online interactive education. We have developed a lot of education to be done with radiologists around reading the low-dose CT scans, reporting them in a systematic way, and so that we've actually got very clear outputs of the program. And we're also doing webcasts and webinars and education for respiratory physicians, because people who are found to have significant nodules that's like in a category 5 or 6 nodule, they're advised to be referred to a respiratory physician who's linked to an MDT, a multidisciplinary team. And we've done some education, lots of education too, with the Thoracic Society of Australia and New Zealand to educate respiratory physicians. So we've got lots of resources. They're all available on the National Lung Cancer Screening Program website, and we're really encouraging people to go to that site and to familiarise themselves with the resources. The other thing to say again, and that I mentioned before, but really important, that people in general practices integrate their practices with the National Cancer Screening Register. It doesn't take long to do, and there is some information on the National Cancer Screening Register website about how to do it. There's also a helpline, so if you're having any trouble, you can just give them a ring and they'll talk you through it. But really critical, you only have have to do it once. And then once you're there, it makes it much easier for people to enrol their patients in the program.
Are there resources to support potential program participants, including Aboriginal and Torres Strait Islander peoples and people from culturally and linguistically diverse backgrounds?
Yeah, so look, just as we've developed lots of resources for GPs and specialists, we've also developed a whole suite of resources for participants. We're about to start a campaign where we're going to really ramp up the promotion of the program, and we expect that a lot of people are going to see that promotion and come in and see their GP. The resources as I said before, have been co-designed with Aboriginal and Torres Strait Islander people, and so we have specific resources that are suitable and appropriate for Aboriginal and Torres Strait Islander people. And we also have resources translated into lots of different languages. So we really encourage GPs to understand and familiarise yourself with the websites, the National Lung Cancer Screening Program website, to identify all the different resources that are available, suitable for all different potential participants in the program.
So, where can healthcare providers find more information and resources?
Yeah, so look, I've mentioned before that we've got a National Lung Cancer Screening Program website it's actually got links to all of the resources on that page. But people can also go to NACCHO, the National Aboriginal Community Controlled Health Organisation. Their website also has a lot of resources. The Lung Foundation Australia has a lot of resources and links to the interactive education that we've developed with LFA. The Royal Australian College of GPs has resources, and in fact, we've updated the Red Book to actually identify the program with resources there. The College of Radiology has a lot of resources on their website, and one of the things we've done with the College of Radiology is to develop an actionable additional findings guidelines. So this is where we find things that are beyond lung cancer in the lungs. It's a real opportunity to find things that potentially are life-threatening, like coronary artery calcification on the low-dose CT scan. But there's also going to be, of course, findings that the person already knew about. So, for instance, we might find in these patients that there might be an increased incidence, for instance, of emphysema. So that guideline on the radiologist RANSCA's website, which is also linked to from the Department of Health website, the National Lung Cancer Screening Program website. And also we have resources on the Thoracic Society of Australia and New Zealand. So the resources are around. We will put a link in the podcast notes if we can, so that it's easy for listeners to find them.
Thank you to my special guest, Professor Vivienne Milch. This podcast is sponsored by the Australian Government National Lung Cancer Screening Program. You can find more podcasts on our website at mja.com.au or wherever you find your podcasts. Thank you so much for listening.